Hi, I'm Rose, a family planning nurse.
And I'm Christine, a family planning doctor. Both of us have put in lots of IUDs. We're going to talk about the benefits and risks of IUDs in a bit more detail than in the other video, and how to prepare for the insertion.
So of course IUDs are fantastic contraception. They're easy to insert by a trained nurse or doctor. They last for a long time, 5 to 10 years. They pretty much work straight away when you put them in, and if you have it taken out it stops working straight away. We call that reversible. Starts quickly, stops quickly. They're very reliable, 99% or more effective, so they're great contraceptives.
So what about the preparation for this? We do want to be sure that there is no sexually transmitted infection when we go to put in an IUD, so we may take a swab beforehand for that, or we may take it at the time of the insertion. If, however, you've got symptoms, we're going to want to sort that out first and treat you before the insertion.
So you may need a separate appointment for that.
The other thing we have to be certain about when we're putting in an IUD is that there's absolutely no risk of pregnancy at the time that we're putting it in. So what does that mean? It means we either have to put it in within a few days of your period, or you have to have used reliable contraception since that last period.
On the day when you come in for your IUD, it's important that you've had your breakfast or lunch. It's good to have something sweet to eat half an hour before the insertion, and it's really good to take some ibuprofen or some other pain relief half an hour before as well, just to help with the cramps afterwards. Most people it goes really easily putting in an IUD, but afterwards you can have some cramping or spotting, which is quite normal. We're going to talk a bit more about other side effects that you might need to come and see us about.
So most people find that IUDs are great, but occasionally there are problems.
So some people do have problems with their IUD. Sometimes they feel as if they have an infection after their IUD is inserted, and this can happen even if we've tested you and we know that you don't have an STI. This is not common, but if you are feeling as if you have an infection, we'd need to see you about that. Sometimes the IUD might not be sitting in quite the right place and it can be uncomfortable, so if you're having any pain or discomfort, we'd like to see you about that as well. There's a small risk of pregnancy with an IUD, so at any time if you're feeling pregnant, you should come and have a pregnancy test.
So you may have more questions that we haven't answered here. We've got lots more information about IUDs on our website, so have a look. And then when you're ready, you can make an appointment.